My name is Gustavo Saposnik. I'm a stroke neurologist at the University of Toronto. I'm the chair of the scientific statement for the diagnosis and management of cerebral venous thrombosis from the American Heart Association. What is cerebral venous thrombosis? Cerebral venous thrombosis is a blockage, a clot in the cerebral venous system. And what happens when that occurs is that the drain of the blood from the brain is stuck and is blocked. What happens is usually on one hand occurs a cerebral venous ectasis and then may occur a bleeding because of that venous hypertension, or maybe related with some other mechanisms and that may lead to different symptoms. How often does it happen? Cerebral venous thrombosis is only affect approximately 1% of all strokes, so it's a relatively rare condition. The problem is that it's not very well recognized, especially when patients present to the emergency department. What are the most common conditions or risk factors for cerebral venous thrombosis? There are many, and I like to refer you to that table if you are interested in those particular risk factors. But what's different in this statement is that we identify some additional risk factors. For example, what we know is that young women, those at the reproductive age, those in which they have a tendency to form clots for any reasons, one of the examples could be the use of oral contraceptives, they are more predisposed to have a cerebral venous thrombosis. Usually the most common clinical presentation is headaches. 95% of individuals with cerebral venous thrombosis may develop a headache. The second most common symptom could be seizures, and that's an important factor to be recognized. Finally, how do we make the diagnosis? We usually need a combination of the clinical presentation, and initiate some investigations such as brain imaging, a CT scan, or an MRI, and in particular, venous images to demonstrate the occlusion of the venous system through the CT venogram or MR venogram.